Thank you, Taizo. Well, we're learning more about concussions. Now, it's not just a problem with professional athletes, as we've seen in the past. Now, kids who play sports also suffer from them. Manolo is with the health experts with more details.
Well, we've certainly been hearing a lot about concussions in the professional sports level. We should address it for kids who are playing sports. Dr. Jennifer King with Kapi'olani Medical Center. Can you tell us some misconceptions out there, especially for the kids and the parents?
Sure. So the biggest thing that I always see in the office is that kids will come in and say, I just got my bell rung, I'm fine, and they don't understand that they actually have a head injury and not just getting their bell rung. Commonly parents come in and say, well, we went to the ER, they did a CT scan and it was normal, so I don't have a concussion. But the vast majority of concussions, you don't lose consciousness, and then you also have a normal CT scan, a normal MRI.
Wow. So what, yeah, you really, for people, they need to take that extra step as far as really finding out what they have.
Right, and it's really important for any child that has a potential head injury, whether it's head-to-head contact, head-to-ground contact, or body-to-body contact, that if afterwards they start complaining about headache, dizziness, feeling nauseous, or any other symptoms and the kid just doesn't look right, they need to rest.
You mentioned body-to-body. They don't actually need a head contact to get a concussion.
Right, they don't need head contact at all. So basically a concussion happens when the brain gets rocked inside the skull, so that if you have enough body-to-body contact and the brain gets jarred, then you're going to have symptoms of a head injury.
Ross Oshiro with the Department of Education, and certainly it sounds like we could all learn, or we need to learn a little bit more about this. There's an event coming up?
Yes, on July 26th, this is our fourth concussion clinic that we're doing, and it's open for parents, coaches, referees, league officials that want to learn more about concussions. We'll be explaining the signs and symptoms that Dr. King talked about, what we can do, what parents can do, how they can help their child recover from their concussions. We'll also be talking a little bit about the new concussion law that the governor just signed on Tuesday, what schools need to do to prepare for that as well.
It sounds like the schools, certainly coaches, are sort of learning more or taking more steps to try to help with it, but especially with those with the sports in sports organizations. But there are others that maybe are not finding out enough about it.
Yeah, there are other groups that don't know as much about concussions, especially parents of young parents, a 5-year-old that just want to start their child out in sports, what to look out for if their kid falls. That's really important because a concussion can happen any place, anytime. They could be slipping on the playground, fall off their bike, and they may have a headache. They may not realize that, but that's part of a concussion.
Howard Lee with UHA President and CEO. Well, this is a problem now that, yeah, we thought it was just, the professional sports, but no, all over the place.
Yeah, we just want to encourage people to attend this important event. If you're a parent or if you're a coach that deals with young kids, I think it's good to get some education on this area and to understand what a concussion is so that you can help the child. I think our message is plain and simple, is just, be careful, be smart, because a child's health is the most important thing.
Thank you very much, Howard. We'll be right back with Wake Up Today.
Catching the wave to better health in Wake Up Today is sponsored by UHA.